Hey you! Yes, you with the glorious chest, whether it's flat, fluffy, firm, floppy, fabulous, or somewhere in between. Today, we're going to talk about breasts, and more specifically, breast cancer. Yes, that serious word that sounds scary but doesn't have to be confusing. Now, before you freak out or click away to watch a cat playing the piano, stick with me because we're going to make this fun, simple, and actually kinda empowering. So grab a cup of tea, a comfy seat, maybe give your boobs a gentle high five, or chest bump if you're into that, and let's go. Let's start at the beginning. Your breasts are made of fat, tissue, ducts, and lobules. Think of them like soft, squishy neighborhoods with hardworking little cells just doing their 9 to 5. But sometimes, a cell mutates. That means it changes in a weird way and starts acting like the office intern who drinks 17 energy drinks and starts photocopying their face at 3 a.m. It divides too fast. It doesn't follow the rules. It forms a lump. That lump could be cancer. Breast cancer is when these abnormal cells grow out of control, sometimes forming a tumor and potentially spreading to other parts of the body. But not all lumps are cancerous. Some are benign, which is science speak for harmless. Still, if you find a lump, don't play guessing games. Get it checked. Who can get breast cancer? Short answer: anyone with breast tissue. That's right. Women, men, non-binary folks, trans men and women, people with large chests, small chests, implants, flat chests, all of us. Most breast cancer cases are in women, especially those over 50. But around 1 in 100 breast cancer diagnoses happen in men. So nobody's totally off the hook. And if you have a family history, like a mom, aunt, or sibling who's had breast cancer, your risk might be higher. Fun fact, well, not fun, but important. There's a gene called BRCA. Mutations in BRCA1 or BRCA2 increase your risk. You can get tested for it, especially if breast or ovarian cancer runs in your family. How can I spot it? This is where you become a boob detective. No trench coat needed, unless you're into that. Self-exams are your superpower. They help you get familiar with how your chest normally feels, so you can notice if something changes. Here's what to look out for. A lump or thickened area. Nipple changes, pulling inward, sudden leaking. Skin dimpling, looks like orange peel. Redness, swelling, or warmth. Pain that sticks around in one spot. Don't panic if you find something, but do act. Talk to your doctor. You are not overreacting. Can I prevent it? You can't control everything, thanks genetics. But here are things that can lower your risk. Eat more plants, fruits, veggies, whole grains. Get moving, 30 minutes a day. Yes, dancing counts. Cut down on alcohol. 1 drink per day max for women. No smoking, not just for your lungs. Manage stress. Chronic stress messes with hormones. Breastfeeding, if you choose to and can, may help. And yes, screenings. Mammograms usually start around age 40, or earlier if you're high risk. They're a little awkward, a little squishy, but they could save your life. If you or someone you love gets that diagnosis, breathe. It's okay to be scared. But you're not alone. Your care team becomes your personal Avengers. They'll look at the type, size, and spread of the cancer and recommend one or more of the following. Surgery, to remove the lump, lumpectomy, or full breast, mastectomy. Radiation, beams to zap cancer cells. Chemotherapy, medicine that targets fast-growing cells. Targeted or hormone therapy, more precise and less aggressive. Treatment isn't one size fits all. It depends on you. And guess what? Survival rates have improved a lot, especially when caught early. Real talk. Let's talk about life after treatment. After treatment, life continues, but it might look a little different. Some people feel stronger, braver, and more in touch with their bodies. Others feel drained or scared. All of it is valid. Support groups help. Therapy helps. Friends who show up with snacks also help. Scars, bald heads, mastectomies, implants, no implants. There's no one way to be a survivor. You're more than your boobs. You're a whole story. Breast cancer shouldn't be taboo or whispered about like it's a curse word. Let's normalize checking our own bodies, talking to our doctors, supporting survivors, celebrating recovery. You never know who might be silently dealing with it: your mom, your friend, your neighbor, your barista. So, lead with compassion and don't forget to check your chest. Before you go, 3 things. 1. Check your chest this week. 2. Book that screening. 3. Share this video with someone you love. It might just save a life. Like, comment, subscribe, and stay tuned for more real talk. Because staying alive should be fun too.